It's 12:30 and time for our coronavirus call-in show. This is where we ask you to call in with your questions on COVID-19, and we have a team of medical experts with us to answer your questions. Our number is going live. You can call in for the next half an hour on 8377088377 and have your questions answered by medical experts. This afternoon, we're being joined by Dr. Suranjit Chatterjee, Senior Consultant, Internal Medicine of Indraprastha Apollo Hospital. Thank you for being with us once again, Dr. Chatterjee. And we're also going to be joined by Dr. Manoj Goel from the Fortis Memorial Research Institute. I also have our first caller on the line. Sampath Ram Meena is calling from Lucknow. Sampath Ram Meena ji, क्या सवाल है आपका?
सर मेरा ये सवाल है डॉक्टर साहब से कि जैसे अभी कोरोना के वजह से हम लोग दही वगैरह को कोई भी यूज नहीं कर पाते हैं, ठंडी चीज की मना किया जाता है, तो क्या यूज करना इस संबंध में कोई है इसका?
आप दही के बारे में पूछ रहे हैं? दही खा सकते हैं कि नहीं?
ठंडी चीज जैसे मार्केट से
ठंडी चीजें खा सकते हैं कि नहीं? Okay. Dr. Chatterjee, he wants to know whether there's any bar on eating cold things like dahi, like ice cream, and is this something that needs to be followed? Is there any special care that needs to be taken?
दही खाने और आइसक्रीम खाने में कोई मनाही नहीं है इसमें। इससे ऐसा कोई नहीं देखा गया कि कोरोना वायरस का इन्फेक्शन बढ़ता है या घटता है। हाँ, कई बार लोग बोलते हैं कि अगर खांसी बलगम बुखार हो या गला में दर्द हो तो लोग बोलते हैं कि अगर ठंडी चीज खाई जाए तो उससे ये सिम्टम एग्रवेट हो सकता है। अदरवाइज जहां तक कोरोना इन्फेक्शन वाली बात है उसमें इसका कोई रोल नहीं है और आप दही या आइसक्रीम आराम से खा सकते हैं under supervision.
All right. I hope Sampath Ram Meena's question has been answered effectively. Let's go on to our next caller. SS Ghosh is calling us from Delhi. Mr. Ghosh, go ahead. SS Ghosh from Delhi, I'm told, is on the line with us. What's your question? All right, we seem to have lost that connection. Ayan is with us from Srinagar this afternoon. Ayan, what's your question?
Hello, ma'am. Being a medical student, I have a question. And there's a commonly called drug, alpha-interferon drug, which is actually used as an immunity booster. So it's actually used for the cancer patients. Now my question is, will this drug be used for a patient who has tested positive for coronavirus? As it's used to raise immunity.
What is the name of the drug that you mentioned, Ayan?
Alpha-interferon drug.
All right, Dr. Chatterjee, are you familiar with the drug's name that is being talked about? And he's asking whether this is indeed immunity boosting and would be helpful for someone who's worried about contracting COVID-19.
Interferon was being thought of as a line of treatment for treating coronavirus at some stage. Okay, as I said, things are still under evaluation. It was definitely there that, okay, it could be used as one of the lines of drugs for treatment. So since it's a novel virus, treatment is all under evaluation. We should keep it as a reserve thing. As days go by, as more evidence comes, then we might be thinking of using, but not as of right now.
All right. SS Ghosh is back with us from Delhi, I'm told. Mr. Ghosh, what's your question?
Good afternoon, madam.
Good afternoon.
I'm 68 and I'm diabetic. I have a question. COVID-19 seems to be RNA virus. Whether it will give the same amount of immunity like RNA viruses after one suffers from it, or it is not yet established?
Dr. Chatterjee?
It is not yet established as to how much immunity would happen. It is always a thought process that once you have suffered from an infection, from a viral infection, it does give immunity for a couple of months, or a few viruses give immunity for a couple of years as well, or maybe sometimes lifelong. But still, it is not yet established as to how much coronavirus infection will give you immunity. But if we have to think as the other viruses, in all probability, it would also give us immunity and protect us from repeat infections.
All right. Aparajita is on the line with us from Mumbai. Aparajita, what's your question?
Yes. So my husband has a neurological condition called transverse myelitis, which needs regular physiotherapy. But because of the COVID-19 situation, the society has stopped physiotherapists from coming in. there are other members in my family who may not have dire urgent testings, but they need tests like sodium, potassium, and sugar to stop it from getting into an emergency. So under this situation, what is the call that we take? Do we give the COVID-19 a priority, or are these also essential?
All essential investigations and essential treatments have to continue. Just the fear of COVID virus doesn't stop that other essential treatments and investigations are stopped. So whatever is essential, under guidance of your treating neurophysician or your treating physician, it has to continue, so that because this is the basic need. If this test is required, that has to be done, and the person has to be treated. COVID-19 cannot stop the other essential treatments from going on.
Okay. That's an important distinction. Yes, certain cases you are being asked to get telemedicine advice, but anything that is essential, of course, has to carry on also. Deepak calling us from Delhi at this point. Deepak, go ahead.
Yeah, I have two questions. One is like...
Deepak, if I might request you to just restrict yourself to one question so that we can get more callers in. Thank you.
Okay, I just want to know that I just read in the newspaper that Boris, the Prime Minister of UK, is not on any medication. Then what is the use of chloroquine?
All right. So, okay, fair enough. The UK Prime Minister currently in ICU, he's on oxygen support. Deepak wants to know if he's not actually being given any medicines. Why is there all this fuss about hydroxychloroquine? What is it meant for?
See, as we have been all saying, all panelists have been saying that the entire treatment depends on how the medical condition is, or how is he doing, depending on what his comorbidities or what other illnesses he has. Because if you give chloroquine to people, hydroxychloroquine or chloroquine to people who have other comorbidities, the treating doctors have to decide whether it can be given and whether it should be given. So depending on the clinical condition, other coexisting medical conditions, the treating team always decides what should be the line of treatment. Anyway, till date, it has not been really proven that chloroquine is the treatment of choice. There are a few studies which say that it might be of benefit, but obviously the treating doctor anywhere in the world, the treating doctors have to decide what should be the line of treatment, what is best for any patient undergoing treatment for COVID-19.
Right. And Doctor, I think we get a lot of questions specifically about medication, about precautionary measures that can be taken beyond all the ones that we're talking about constantly, including the frequent washing of hands and sanitization and so on. I think everybody wants to know whether there is some kind of drug that you can take. I think it's important to clarify at this point what the position is, because people have all these questions. It is a novel coronavirus. So have the prescriptions in any way changed beyond what we have initially heard?
Till now, nothing has changed. A few people are asking about vitamin C. A few people are asking about hydroxychloroquine.
Yeah.
Hydroxychloroquine till now, and it should be limited to really people who are healthcare workers who are treating infections of COVID-19, because there are several side effects of this drug which has to be monitored and can be only given under supervision of a treating doctor or a qualified medical person. A few people have been talking about vitamin C in large doses. People have used it in older times for building up the immunity, but also against novel coronavirus, there's no definite proof that is going to help us. A few people are coming out with homeopathic medications, Ayurvedic medications, but as of today, there is no definite consensus on any one of these drugs that they would be of help, even in preventing the coronavirus.
All right. We have one more caller on the phone line, Umair, calling us from Srinagar. Umair, go ahead.
Good afternoon, ma'am.
Yes, good afternoon.
Actually, ma'am, I want to ask, ma'am, I'm a patient of chronic urticaria with angioedema.
Sorry, could you just repeat that a little slowly, please?
I'm a patient of chronic urticaria with angioedema.
Okay, and what is...
Right now I am on immunosuppressant, cyclosporine.
Okay, so you're asking whether you're at special risk or not?
Yes, ma'am, I'm asking about that, and what should I take to boost my immunity?
Okay. So, Dr. Chatterjee, he suffers from chronic edema. He's on immunosuppressants. He wants to know whether he needs to take any special care or whether there's anything that he can have to boost his immunity.
Basically, he suffers from urticaria with an angioneuritic edema. There's again a severe allergic condition, and that's why he's on this immunosuppressants. Anybody and everybody who is on immunosuppressants will be obviously at a higher risk of contracting this infection. Unfortunately, we don't have any such immunomodulators, any such proven immunomodulators which are going to prevent his infection. So he should be very, very careful regarding all the lockdown and directives, all the hygienic measures that have been told several times on all the channels. So he has to see to it that he follows all of them regularly so that he doesn't contract the infection, because if he contracts the infection, is obviously the way upward could be more dangerous in his case.
Right. Before I go to my next caller, I'd like a check on our other guest, please. Dr. Manoj Goel, who was supposed to join us on the show. Can we try dialing him again? And we're also being joined by Vansh and Rahul, but please let's keep checking on our other panelists as well. Vansh from Delhi, what is your question?
Hi, my question is, I want to ask, if suppose I'm cured of COVID-19, how long would I stay as a potential carrier after being cured?
All right, Dr. Chatterjee, he might have tested, in the event of him testing negative, does he still continue to be a carrier?
He could be an asymptomatic carrier. They can be shedding the virus for a while. Till now, they say that they could be shedding the virus for 7 to 14 days more. So you have to be really careful for the next 2 weeks, even after your treatment is over, and you have to be under supervision of your treating doctor.
All right, that's an important thing to note, actually, and that would explain, Dr. Chatterjee, why the WHO is also asking for home quarantine for another 2 weeks at least, even after COVID patients have, for instance, been discharged from hospital or tested negative in at least 2 tests. Is that right?
True.
Yeah.
Absolutely. That's the main reason for it.
All right. Before we go across to our next caller, I'd also like to ask you specifically about the underlying comorbidities. I mean, we've been talking, of course, of diabetes and hypertension as being complicating factors. But specifically, for instance, for diabetes patients, beyond being extra careful, beyond following all the existing rules of washing hands, of maintaining hygiene, is there anything else that diabetes patients should be doing?
The main thing is you have to obviously follow all the things that you said just now, but control of blood sugar. Control of blood sugar is very important. It should not be that your sugars are haywire, because once your sugars are haywire, your immunity levels are low and your chances of contacting the infection or dealing with the infection is difficult. So controlling of sugars, have proper sleep, do exercise at home if there is no other contraindication, have the right food. So other than the usual measures, control of blood sugars is very important so that you don't contact the infection, or even if you contact the infection, you can fight it in a much better way.
Right. Dr. Manoj Goel is now also with us. He's Director Pulmonology of the Fortis Memorial Research Institute. Dr. Goel, thank you for joining us, albeit somewhat late on the program. We also have a caller, Rahul from Delhi, I believe, is with us. Rahul, go ahead.
Yes. Good afternoon, ma'am. Good afternoon, sir. I have a question with you.
Yeah, go ahead.
Hello.
Yeah, we can hear you. Go ahead.
My question is that if we go outside to purchase necessary items or goods, so after that we got some return currencies from shopkeepers. So what should we do with that currencies? Because
all right, you're asking whether the currency notes can be infected or not, and if there's any way to sanitize those. Again, a very frequent question. Dr. Manoj Goel, if you'd like to take that.
Very interesting question, and the thing is, yes, technically it is possible that you can infect a currency note also because it's a droplet infection. But generally, the chances of getting infected are very, very less. Practically it's possible, it's very, very less. And if at all it is infected, the infectivity or the infectious material can stay there only for a few hours, not more than that. So ideally, that if you handle the currency note, please, keep it at a place for some time, maybe for a few hours, and then you can use it, or maybe as traditionally what people are doing, they are putting it over they do some sort of ironing over that. that can help. But as it is, there is no real evidence. I mean, that I'm talking theoretical. There is no real evidence that the currency note gets infected, and we have to be so scared of, using that.
Right. I think we keep getting asked both about newspapers and currency notes as being things that people are constantly handling, and so the worries about this are clearly high. But I think we've heard repeatedly from doctors that there is nothing to worry about as far as these things are concerned. Just keep taking all the precautions that you would normally take. Is that right, Dr. Goyal?
So you have to keep washing your hands. So you handle it and keep washing your hands. That is what you have to do.
Right. So handle whatever you have to, but wash your hands, because you can't stop these things altogether. All right. A quick question before we get to our other caller, and if Dr. Chatterjee would like to answer this. I think one thing that, again, a lot of people have called in about or raised questions about is, what about people with sort of existing critical conditions? For instance, people who need dialysis. What the lockdown has done is restrict the movement of people. Many people who do home dialysis are now finding it hard to have their carers come and sort of perform those dialysis operations on them and so on. And they have raised questions about this, whether any sort of passes can be made available to these carers, assistants who come and carry out these procedures. There's really been no specific moves by the government to make their passage easier. Dr. Chatterjee, do you have any solutions or any words of advice for renal patients?
See, quite a few patients who are coming to our hospital, what we are doing is, at least what I am doing when patients are coming and getting admitted, and the non-COVID patients, we are giving them a hand on a letterhead and signed by the hospital. We are giving them a letter that this patient and so is admitted to the hospital if they can be allowed. What they are being also directed is to go to the police station, which is opposite our hospital, and they can get a pass from there on a definite evidence. But obviously the government has to look into it, because as we have been always saying, that other essential treatments should not stop. Other essential things for anything and everything should not stop. They have to continue even if there is a lockdown continuing. So the government has to look into it with definite evidence. Obviously, people should not misuse it, but with definite evidences, that maybe the local police station or somebody has to be given the authority to issue a pass so that the other treatments can also continue.
Yes, and also I think we're now at a critical period where we're looking at perhaps further extensions of lockdowns, specifically in the larger cities where there have been more cases. So there need to be kind of more long-term holistic solutions which will allow people to get on with their lives, and especially essential treatment, at the same time keeping social distancing norms in mind and following them as much as possible. Neha joining us from Chennai this afternoon. Neha, go ahead.
Yeah, hi doctors. So my question is, I wanted to ask what is the incubation period for the symptoms to show up? And one more question is how I will get to know it's a COVID-19.
All right.
Which is the main symptom for that?
Okay. Dr. Goyal?
Yeah, so the incubation period is from glass up to maximum 14 days. So if anybody is infected, would get symptoms in 97% of cases by the day 12. So that is the thing it is. So if you have a history of contact and you have been asked to go into quarantine, so you have to be in quarantine for 14 days. That is what the standard practice is all about. Now coming to the second question, how would you know that you got an infection? See, if you got a known contact who is COVID positive, then you have to be careful about it. Then you watch for the symptoms. That is your cough, breathing difficulty, and fever. But nowadays, standard guidelines are, even if you don't have a contact, if you have a cough, fever, and breathing difficulty, go and get yourself tested.
All right. We'll come back to Dr. Goyal in a moment. I'm going to take a quick couple of callers now. Vivek is with us from Vadodara. Vivek, what's your question?
Yes. So my question is, if a young, fit patient, person, he gets infected by COVID-19 and is admitted, so on what basis would the treatment line be decided? All this treatment, this anti-malarials, antiretrovirals, and all those things, they are under still investigation. So how does a doctor decide what treatment line to be given to such a confirmed patient?
Okay. All right, Vivek, we'll come to that in a moment. I'm going to take one more question. PK Mishra is with us from Bhubaneswar this afternoon. PK Mishra, what's your question?
Good afternoon, ma'am. This is PK Mishra from Bhubaneswar. My question is regarding this community transmission. Actually, it's been already 14 days since we had a lockdown from the 25th of March, and since when we had a ban on international and domestic travel as well.
Yeah.
So could we safely assume from tomorrow? It's been 14 days already. Tomorrow is, I think today is the 14th. Or tomorrow is the 14th.
I think today is day 15, but yes, yeah.
So tomorrow, can we safely assume that all the new cases coming up tomorrow is that of a community transmission, and we shouldn't be talking about travel anymore?
All right, that's a very interesting question. We'll take that first. Dr. Chatterjee, if you'd like to answer that. It's a question about the lockdown and presumably how effective it's been. It's been 14 days. So can we assume that if there are still cases happening, then we are well into community transmission rather than just imported cases?
No, as the lockdown days increase, the history of travel from international places would obviously, the importance would go down.
Yeah.
Okay. It would be more of contact with people who have been to COVID positive patients, or who have been treating them, or who have been tested positive. That will obviously be more important. Also, to check for any community transmission, as the ICMR has already said, that if you have symptoms like influenza-like symptoms, if you have cough, fever, cold, and obviously breathlessness, then they should go. They should report to the nodal officer or to the doctor or to a designated center. And depending on the symptoms and the criteria, they might have to be tested, and the testings would increase in the next couple of days. The government has already increased the number of testings, and they would be important. So the travel history is going to become less important as days go by.
Yeah. Dr. Goel, if you would like to answer Vivek's question, if a young, healthy person is infected and is hospitalized, is there some kind of standard operating procedure that hospitals follow as far as treatment is concerned? Yes, we're hearing of certain hospitals using, for instance, anti-malarial drugs or other drugs. Is there any kind of specific treatment that's being followed, or does it vary on a case-to-case basis?
Yeah. See, if the patient has got uncomplicated disease or just mild disease, not just, fever, cough, then the treatment would primarily be symptomatic, and that would be applicable on 80% of the patients. It's only 20% of patients would fall into the second category, would be seriously ill, or those who would require critical care. So the patient who got seriously ill, those who got pneumonia, those who got a low oxygen saturation, in those cases, we use these off-label drugs, what we call as azithromycin, HCQS, or the chloroquine that we're talking about. And many of these drugs have got a weak evidence they are effective. And FDA has already given and even the ICMR has also given an advisory that we can use these drugs on case-to-case basis who are seriously ill or critically ill. But they are not to be used on mild cases or asymptomatic cases on a mass scale. So that is the protocol that we are following at this point of time.
All right. Thanks very much indeed to both our medical experts who joined us on the show today. That's all we have time for on this edition.